Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be talking about Promogran Prisma. But first, if you could hit that like and subscribe button, it would be greatly appreciated as it truly does help my channel grow. So let's get started. So Prisma is a wound balancing matrix that does contain 55% collagen and 44% oxidized regenerating cellulose and 1% ionic silver. So this does make the product an antimicrobial, and it does work great at healing wounds that have stalled in the healing process. So sometimes we get wounds that are healable, but they stall and they're just not progressing. So this is an awesome matrix that you put into the wound, and it does kind of kickstart it to start healing again. So if there is any dry necrotic tissue or slough, it must be removed first before you can use this product, okay? So either you can use surgical, enzymatic, autolytic debridement, but you do have to realize with the enzymatic or autolytic, it is a lot slower of a process than a surgical debridement. So it just completely depends. If you can have it just removed, then you can start with this right away. So what we're going to do is first cleanse, irrigate just with some normal saline, and make sure to dry the peri-wound tissue. You're then going to cut the Prisma to completely cover the wound base. So this goes directly into the wound bed. Okay, and it doesn't overlap onto the peri-wound tissue. If the wound is moist, you just apply it in dry. If it is a dry wound, you add a little bit of saline on top of the Prisma once it's applied. Okay, and then you're just going to apply an appropriate cover dressing to maintain a moisture balanced wound. So to remove this dressing, it actually does completely dissolve. So it is biodegradable. So it's going to turn into a gel and absorb into the body. Okay, so there is no really residual that needs to be removed. So when the frequency of dressing change, so it's going to depend on the amount of exudate. So Prisma usually gets absorbed within 3 days. So we just kind of check it for the first few dressing changes, but normally over 3 days it'll absorb. And then the expected outcome of this is that signs of local infection. So this is a topical, so local infection is resolved within 2 weeks, and you have measurable improvements in wound size, okay? So with that said, antimicrobials, we're using this for a local wound infection. Now, if there is a more deep spreading infection, we can also use this, but it has to be in combination with our antibiotics. So indications for use. So we're going to be using this in wounds that have a cellular imbalance. So a wound that has stalled, it is a healable wound that just does not want to heal. Okay, so there's no factors that are affecting the actual healing of this wound, so it should heal. So the wound has to have a clean wound base, so it's free from slough, necrotic tissue, and also a wound that shows signs and symptoms of a local infection, okay? So that can be a diabetic ulcer, venous ulcer, pressure ulcer. It can also be used under compression therapy. Precautions. So you always want to consult with a wound care consultant prior to using this product. Contraindications. You're not going to be using this if the patient has any allergy to cellulose, collagen, or silver. We're not going to use this in the presence of necrotic tissue. And we're not going to be using this on 3rd-degree burns. That's all I have for this video. I hope you did find it helpful with your daily practice, and I will catch you in my next video. If you haven't subscribed already, please do so, as it does truly help my channel. So I'll catch you in my next video, guys. See ya.